Okay.
Am I okay to proceed?
Yes, you are now live. You may proceed.
Thank you. I'd like to call the Health and Human Services Committee meeting for Wednesday, November 16th, 2022 to order. Madam Clerk, would you please call the roll?
Alderwoman Green. Alderman Gunther.
Here.
Alderwoman Middlebrook. Alderwoman Rice.
Present.
Alderman Todd. Alderman Grass. Chair Gracia.
Present.
Alderwoman Green. Alderwoman Middlebrook. Alderman Grass. We have 4 present.
Thank you. The first order of business is approval of the minutes from the October 6, 2022 committee hearing. There is a copy in your Google Drive folders, and if you've had a chance to review those, I would entertain a motion to pass those out.
So moved.
Second.
Madam Clerk, please call the roll.
Alderwoman Green. Alderman Gunther.
Aye.
Alderwoman Middlebrook. Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Alderman Grass.
Aye, or here, are we taking attendance? I'm sorry, I just joined.
We're voting on the meeting minutes from October 6th.
Oh, I'm sorry, I thought it was attendance. Okay, well, I'll still be aye.
Chair Gracia.
Aye.
Five aye votes.
Thank you. By your vote, you've approved the minutes from the October 6, 2022 meeting. We will dispense with line items 4 through 5. And the only thing on our agenda today is a conversation with Dr. Madi Shushwayo Davis with the Health Department about the Bureau, the new department of the Behavioral Health Bureau. Dr. Madi, thanks so much for joining us today. I know this is a really exciting development in the health department and a much needed piece of what needs to be added in terms of services for our residents. And so if you just want to take as much time as you need to kind of go over the Bureau, and then I'm sure the committee will have questions.
Thank you so much for having me today. So good to see everyone. I'm going to share screen and share some slides that I have to just introduce the work of the new Bureau and specifically the overdose crisis that we'll be attending to first. So I think it's important by way of level setting that everyone remembers the mission and vision of the department, assuring a healthy St. Louis through quality public services and partnership by providing continuous protection, prevention, and promotion for the public's health. And our vision is St. Louis, an equitable community achieving optimal health for all. We try to do that, and this is in coming directly out of our CHIP and reaccreditation process. That is a regional an alignment through integrity, community engagement, systems level change, and regional approach, leadership and professionalism, a data and results driven process, but fundamentally through a lens of racial and health equity. So part of our 6 strategic plans for FY19 through 23 are to strengthen our leadership and workforce, support community health planning, implementation, and evaluation. Really do some key work around data-driven planning, implementation, evaluation, and QI. Strengthening our information systems, advance racial and health equity, and identify sources to support personal and population-based health services. So I just recently celebrated my 1-year anniversary with the city, and I remind this group that when I joined in October of last year, one of the 3 priorities that the mayor and I discussed while I was being interviewed were in parallel COVID and non-COVID priorities. And of those non-COVID priorities, gun violence, behavioral health, and chronic disease. I was shocked to discover that all three of those priorities did not have one person employed through the city's health department to do any of those work. The work that was happening in any of those three sections was through contracts and subcontracting out, and then some minimal programming efforts that fit into other bureaus by way of chronic disease. That should worry you, and that's something most of you have heard me talk about at multiple platforms, but it impressed upon me that it would be impossible to create from nothing a workforce and implementation strategy to address all three of those. And so worked with the mayor's office to build the now Office of Violence Prevention that is housed in the mayor's office, to which different departments, including mine, feed into. And Will Pinckney, who directs that, has been a great partner, and that is building out very well. And that allowed us to then advocate for these 14 salaried positions through the budget. The mayor and I both inherited a budget that's only 1% of the city's budget, woefully inadequate to do the work of public health. And this already in a state that as of 2021 was 50th in per head spending on public health. So Missouri spends a meager $7 per head on public health, compared to Arizona and Hawaii on the opposite end of the spectrum that are spending $149. So it creates a great challenge to create something that provides capacity to do all of the breadth and scope of behavioral health for the city. So the goal is to start with what we see as one of the main crises here. And I did a lengthy listening tour with leaders in the region, spoke to close to 20 leaders in the region in different segments, including but not limited to leadership at Department of Mental Health, the Behavioral Health Network that convenes a lot of the longstanding city leaders around behavioral health, the Mental Health Board. And then recently we had 2 sets of webinars, many thanks to Alderwoman Rice and others of you who joined those webinars that we did invite all Board of Aldermen members to attend, to really talk about the work that is happening. Because of the limitations in hiring in the city that you're all well versed with, non-competitive salaries. And when I joined, a 6-month turnaround between, on average, advertising a position and being able to have someone employed in a department makes it difficult for us to build a workforce. And so we went into contract with the CDC. I leveraged a relationship we've been building with the CDC director and CDC National. After her historic visit, visiting our health department as the first health department she's ever been to during her tenure as director of the CDC. And they were gracious to offer us 7 salaried positions through the CDC for a 1-year contract to work on strategic planning and implementation so that we can have a living, breathing, sustainable, and accountable plan and processes and protocols in place so that regardless of the unfortunately high turnover rate of workforce in public health and in the city currently, that work would continue. So I'm just going to go through a little bit of what that looks like. The 2 main priorities that came out of my listening tour were that folks wanted us to help with work in the opioid crisis and specifically around coordination of services, and then that they needed a one-stop shop through the health department of traditional and non-traditional vetted mental health services for the city, especially for the most disparate zip codes and minoritized groups within our city. And so some national data around what is happening with mental health. 74 million Americans had a mental health disorder in 2020. 53 million age 18 and older had a mental health disorder as well. And 27% of those had a serious mental health illness. There's clearly a crisis around behavioral and mental health that has been longstanding and that we all know has been exacerbated by the COVID-19 pandemic. I'll make sure these slides are available to you so you can go through a lot of the data on your own, but we'll not go through that on individually. Here in St. Louis, mental health disorders and related ER visits were the highest in the city of St. Louis for all races and age categories, including in adolescent age groups between 2015 and 2019. when compared to the state. And even though there are more mental health disorder treatments in the city compared to the county and state, so it's a real crisis. We looking at mental health disorders amongst substance use disorders. These were more prevalent in African-American populations than the Caucasian population. This is consistent across a range of public health and health crises in our city. And so it is clear that this was a long needed bureau and that the work really needs to be vested within that intersectionality between mental health and substance abuse. So, I think the rationale is clear. We need to do this now because of this prevalence of mental and substance use disorders. Age, race, and socioeconomic disparities in the cities are prevalent. Promoting behavioral health awareness, effective preventative measures, and early detection and treatment, we believe can help improve not only mental and behavioral health, but overall physical and community health. And so prioritizing this behavioral health bureau as part of a comprehensive public health approach from the City of St. Louis Department of Health can help to ensure efforts are coordinated and impactful. So we're hoping for a St. Louis where every person can realize their own potential, cope with normal stresses of life, and contribute to the community. And achieving this vision requires a few things: promoting well-being. When we seek care, we actually get the care we need, having access to compassionate, integrated and coordinated care, acting early, and having the data to understand and improve behavioral health. So the overall structure is being worked on, but we have sent in August, actually, personnel has had our list of positions, and unfortunately, because they are still working on backlogs, the new system and the new director, we have yet to have these positions posted, which is why I stress the importance of me having worked with the CDC, because we would still be waiting, which is some of the unfortunate issues with all city departments. But our hope is that once these positions are posted and we're able to interview, that we will have a table of organizations for that bureau where there's a bureau chief, administrative support, a section that looks at health promotion, community engagement, a section that looks at linkage to treatment, care, and recovery support services, epidemiologists to support that, public health coordinators that do a lot of the outreach, responsible for health communication, school strategies, community health, for example, and then other coordinators around substance use and other activities that you can see here, all of this being supported by public health educators and public health nurses as well to round out this work. So the goal is to identify all of our community partners, create a space for engagement, collaboration, and support. We've already had 2 very successful webinars with over 50 community partners each that attended, robust conversation, and an overwhelming gratitude for us moving into this space and support for. There were some challenges that were addressed that was the goal of this as well, so that we can address those early in the strategic plan. Some of those are understandable frustrations around, with every change in both mayoral and departmental leadership. It feels for a lot of these leaders who've been doing this work consistently for decades that we start from the beginning, but that's the whole reason behind bringing in a CDC team for the first year, to really solidify processes and policies such that regardless of who comes and goes, the work is not affected, and that there's hopefully seamless transition and continuation of work. We also need to develop new ways to share data and materials to address the behavioral health issues facing the people of St. Louis. So one of the things I've been successful in doing is when I joined the city, there were only really 3 epidemiologists to support the Department of Health. I've built that team out to 10. We have a dedicated epidemiologist and a dedicated health equity epidemiologist. And as part of the CDC team, I have a dedicated data analyst, epidemiologist, and health and diversity, equity, and inclusion specialist as well. We also want to work in partnership with schools to develop a joint plan for advancing behavioral health services in children. And we're fortunate to have great partnership with the leadership of the Mental Health Board, who I've been meeting with bi-weekly since I started this job. And then through community collaboration, begin the task of addressing substance use in the city of St. Louis through a strategic plan, prevention strategies, and coordinated treatment and recovery efforts. So the implementation of this, we're hoping you'll see in the spring. We've been following a timeline that we are on track for right now. So we're in that strategic planning phase, but through the spring, you'll start to see a lot of the implementation begin. A lot of this is dependent upon, of course, if personnel can get these jobs posted and we can start hiring these positions. Because like I said, as of now, they're not even posted. So I have zero workforce outside of this wonderful group of people. So these are the 7 CDC folks that have been working with me since August. Our brilliant leader, Scott Timms, is the program coordinator. Sherilyn Duckworth does the DEI and health equity component of this and works with my overall health equity person in the epidemiology bureau that I hired about 6 months ago. We have a data analyst and an epidemiologist here, program coordinator and strategic planning offices here as well. And then an assessment coordinator to make sure that we are dealing with assessments as we go. These folks have been so brilliant that when the CVPA shooting happened, we have actually provided mapping services for where services are in the city at the request of leadership in the city. We've been meeting with leadership in the city every 2 weeks. So they've already been providing an implementation and very present support in parallel with this ongoing contract. So when you get these slides, you can look at the substance use trends. We provide a monthly behavioral health report. So even in the absence of a bureau, I thought it was important to have good data around what was happening in the city. So in those departmental monthly reports I send you all, you get monthly data on behavioral health, and there are more detailed reports on our website every single month. So you have access to substance abuse and behavioral health data for the city through those 2 avenues. So you'll be able to read all of these. Things that I need you to be aware of is that deaths by drug type in St. Louis have doubled between 2017 and 2020. So this is, and as you can see, that disproportionate impact in Black communities that it persists across conditions is true here, and then speaks to why we're doing that. So our goal through the specific project that we'll start implementation for in the spring is to reduce deaths from opioids through prevention, treatment, and harm reduction, and to use data to describe the problem, target interventions, and evaluate effectiveness. When I started this job, you know, or hopefully you should know, because you've heard me talk about it enough, that I requested a first of its kind ever monthly meeting with the county and our joint boards. We've been doing that consistently since I started this job. It's resulted in a lot of joint policies and alignment, shared help. And this is no different. The county has a great behavioral health bureau that's been doing this work. So we'll continue to make sure that we are working with them and that there's alignment in what we do. Because it's clear that while there are differences in the city and the county, there needs to be alignment around implementation. And so the objectives here will be to deliver a comprehensive map of services related to substance use prevention and treatment in the city, develop and implement a dashboard for the city of St. Louis that highlights key metrics for substance abuse and overdose by January, and we're well on track. The mapping services, I've already looked at the draft of this. So like I said, we're ahead of schedule. And then in phase 3, to develop a strategic and implementation plan to address substance use and opioid overdose in the city of St. Louis that you will all be privy to in March. And by May, to develop a health equity roadmap related to substance use and opioid overdose for the city of St. Louis as well. So we've already started our community introductions. We sent introduction letters to the OD2A, our work, and the new task force. We sent data highlighting the impact of opioids on the community. We've had 2 Zoom coalition meetings that I told you. We had close to 100 people in total for 2 different meetings. And we've already sent a community assessment for which we've exceeded our goal of 20 respondents. We got over 50 respondents, and that is being analyzed by our folks. We're going to build a task force. This is where some of the frustration was. There have been prior task forces in the city. Unfortunately, because there's no documentation and of how those meetings are run, what was achieved through those meetings were disbanded mainly due to COVID as well. So we do think it's important to bring that up, regardless of whether people are frustrated that it's happening again. It needs to happen. Our goals for that is to build upon previous work around substance use, which is why we've reached out to former participants, trying to create a space for everyone to be at the table to discuss substance use, opioids, and overdose. And then the primary goals will be, again, the strategic plan to be vetted through community leaders, develop a structure for ongoing implementation, and then build capacity across our community to address substance use and overdose deaths. So it'll have this sort of structure that you can read when you get these slides around the steering committee, subcommittee focuses, task force work, and then strategic planning timeline. So timeline, like I said, is going well, but this is what you can expect at different time points. by way of deliverables. So I'll stop there and I will take any questions.
Thanks so much, Dr. Mahdi. We'll start with Alderman Gunther. Do you have any questions?
Just thanks, Dr. Mahdi. It looks like you're pretty busy. And I also think that I'm looking forward to getting the kind of those slides. We ran through quite a few things. I know on that you said there's going to be kind of a more detailed table of organizations sent out. What I was looking for in there is, I know that you have a lot of people there kind of putting the data together, working with outside stakeholders to try to implement some things. Part of your organization for this, will there be basically like outreach people that we'd be able to call when there are problems or we know of certain situations to where you'll actually be able to have people go out in the street and kind of have like outreach officers? Is that going to be part of that structural table in there?
So, I think that's a great question. And I think it comes to, again, the realities of funding and what I have capacity for. We have 14 salaried positions for the entire Bureau. That should highlight to all of you that there's absolutely no way that the city will be doing those services independently and completely. So I think in the beginning, the most we'll be able to do is to join the people who have been doing this work and have been doing awesome work. We have hospital systems, community-based organizations, but the limitations are around coordination. So yes, there should be a number you can call to link people to services. That doesn't mean, because we have no clinical arm, and again, 14 salaried positions is a great start, but not in any way a standalone comprehensive behavioral health through the city program. And if there's an interest in that, then we need to prioritize public health. You know what I mean? And that's what it comes down to. So for what I've been charged with and what we've been given, I think that the overall strategy will be to coordinate between partners within the city and to make sure that that's as seamless as possible. We have great relationships with BHR. I've been working closely with the hospital systems, and they're available to us when needed. But without that central coordinator, it's really hard to make that happen. So some of the salary positions I have are 2 public health nurses and management positions that we can definitely work towards coordinating. But the reality is, again, if I was funded in July, I don't even have a job posting and it's November, right? We're about to be at Thanksgiving. And then it's a 4 to 6 month turnaround. I may not have one person for this Bureau through this year without support to move that along. And again, the diversity and the strength of the pool of applicants is limited when salaries are non-competitive as well. So I can't promise you really anything at this juncture until things move through personnel and I get to see what kind of applicant pool I have, right? But in a perfect world, if that moves forward and we get to the implementation stage in September, we would like to see the beginnings of like a coordinated strategy with all of our community partners, which is why it was important to bring them in at the beginning. Does that help?
Absolutely, yeah. And I kind of, I think that's the answer I knew it was going to come. So when I have constituents asking me, whether it's, addiction, homeless, mental health. So I usually, refer the number to BJC Behavioral Health, which does have some outreach officers. So I guess my if I'm understanding correctly here, so you're already coordinating with BJC Behavioral Health. So when they get the call to go do outreach, then you're kind of collecting that data as well. Is that correct?
Absolutely. And I think what will be important is based on, the feedback you're giving, which is spot on. It'll be important for us, even in the absence of a living, breathing, independent machine, to provide a very clear and easily available list of resources, number to call, to leadership like yourself, to the city in general. And then there's a culture shift, right, that happens with people getting used to believing that if they pick up a number that's affiliated with the health department, that it will yield something. That's going to take time. I don't even have people today. I had a meeting with leadership. Like we've been providing, our website is equipped to provide translation services in 15 languages on the spot. I've had leaders complain to me for the whole year about how we're not accessible through language. And when I finally said and shared screen and said, you can hit one button and the entire website is in your language, they didn't know that. And that comes down to the fact that I don't think people are used to just coming to the health department for information, right? So I think even that exercise, changing the culture, making sure that you guys are equipped with the resources you need and get back to me. I'll be very honest in giving feedback right back to you guys. I send monthly reports. I ask questions in my emails. Very rarely do I get any sort of interaction responses back. Some of it is because I think a lot of you are very, very respectful of the fact that I'm probably really busy, but it's also my job and I don't want it to feel like a barrier. I think, through appropriate channels, that's the way it should work and breathe. So my hope is that I can get you the resources to share with your constituents. Another part of outreach that I think is really important and has been lacking is the fact that, I do a lot of town halls and they've become really well attended. And that's a really great way to get people information and talk to them, but they've all been via Zoom because of COVID. So I need to start coming out to neighborhood meetings. So in a couple of the monthly reports I sent out, I did ask for folks if they were interested in inviting me. Again, didn't get one response, but I would like to be able to, at least once a month, be at different community meetings to sort of provide this information. And when we have the type of resources you're specifically asking for, Alderman Gunther, to be able to provide that. But I think we are hiring a dedicated communications person just for the Bureau because we think that work is so important, right? Like the education, the culture shift, and the accessibility. So I think we can work really closely with you guys to make sure, because a lot of you have great ways of communicating. I think you're like the direct, I would like to see, I think you probably challenge me and how many emails you respond to in a day, because I think you're more like a direct person, but I know others have newsletters, some of you do community meetings. So if you had a central person or, working with me, we can get you what people are asking for. But, I'm happy to take feedback if you feel differently, but I think a lot of it is just a culture shift and people not really believing that the health department is in this space and that they're going to do what they say they will do when that time comes. And, that's understandable.
Wonderful. Again, thank you so much for all your hard work. This is an amazing work that you're doing. And
it's my team, Alderman. They make me look good. I'm increasingly uncomfortable by the congratulations I get because I get to come and meet with you guys. And it's literally a team of brilliant folks who are doing this work. So thank you for appreciating that. And I'm trying to do better at making sure that they hear that and they see that and they know that it's appreciated. But I think my take home points based on your comments are, number one, making sure I get you guys an easy, accessible, contact list, who to at the beginning of this. And then lean into you guys for support if I'm not able to actually start doing the things I'm trying to do on behalf of the city.
Perfect. Thank you. No further questions.
Alderwoman Rice.
Hi, thank you so much, Dr. Mahdi, for coming and talking with us. I was sitting over here just while you were answering questions as well, going through the year reports from October 21 to October 22. And if folks have not taken a look at that, please do. And to just what you were saying, the list of accomplishments on page 22 from the entire, all of these incredible staff that we have that are doing incredible things, going to conferences, getting awards, publishing, man, it's incredible. So thank you so much to you for your leadership. Thank you to your team for their incredible work. We have said, I think this committee has been wonderful to be on, to try to learn more about what real public health support looks like in a city like ours, what it should look like and what it currently does look like. And I think the way that you and your team have presented us with information is incredible. That page 23 list of important phone numbers, I highly recommend. I'm going to pull that out and mark that on the wall because that's really helpful as well for all of the different programs, direct phone numbers for us to get into. It's really just incredible to see what you've been able to do in a year with the challenges that you have had in front of you. I know that this is an uphill. All of us in these jobs are pushing giant stones up hills, but I feel like even more so in your department with the support that you deserve and maybe don't have financially in a city that has undervalued the work. So I just a huge thank you. And especially for this program, for one of the things we talk about all the time in St. Louis is these silos of organizations that are working independently, that are all doing wonderful things, but how much better could they be doing if they were coordinated, if we were organized and moving together? And this bureau is exactly that. So pulling folks together and leading from a city department, and not just letting individual organizations do what they need to do, potentially overlap, potentially, use resources that could be shared in a way that is beneficial to everyone. I think that's really important. The statistics are sobering on the drug use and substance abuse and mental health. That is, I think we all saw upticks during the pandemic, as we know that human connection is so incredibly important for mental health, and as we lost a lot of those interactions, that was significant, lost people's access to regular healthcare, and it's increasingly difficult to get in to find mental health care as folks are seeking it out. Those resources become slimmer. So thank you for centering that for us, and I am hopeful. So I guess my question is, you mentioned the postings in personnel was because personnel is moving to a new system. Is that where the delay is?
Yeah, I mean, personnel, God bless them. They've been a wonderful partner to me. If you looked at the impact report, the annual one I sent, thank you for reading it. Thank you for referring to it. There's a lot of cool stuff in there. Yeah. It's dense, so I can help with cheat sheets for those of you who want them. But I do a workforce capacity update for you in the first 3 pages, and that's all personnel. I broke records and be able to hire 43 people, but the turnover rate is even more shocking. I lost 30 people in that same amount of time. I want you to sit with that and think about how almost impossible it is to grow a department when you're breaking records and hiring, but the turnover rate is that high, right? And I do exit interviews that we didn't have before that, and it's number 1, salary, number 2, benefits and work-life balance, and then number 3, burnout from the pandemic as well. These folks are doing the work of 3 to 5 people, and the pay is just not competitive. Kudos to Mayor Jones and her administration for increasing salaries across the line. But again, they inherited such a huge deficit that there's still so far to go for us to be competitive. I lose people to the county and to hospital systems. I lose them to Amazon drivers. You know what I mean? Because it's just not competitive. And so until we provide livable wages, I just published an article around the midterm elections and public health for the British Medical Journal. I encourage you to read that. It talks about what we need to do to invest in public health. So I'll be the first one to say that Mayor Jones inherited what I inherited, but I'm frustrated. I'll continue to be frustrated because the disinvestment in public health limits what I can do for you and what this brilliant team I have can do for you, right? So the workforce capacity that you referred to on page 3 is big. That wouldn't have happened without partnership with personnel. They put up with me. I literally have the cell phone number for 3 of their top people. I talk to them almost daily. I had scheduled meetings with them weekly. I hired a person and moved my table of organization to have a dedicated personnel person. And so we were able to break records that way. But it's that turnover piece. And now the fact that they are highly, highly understaffed as well. And so they have backlogs, and they're trying to change to a paperless system that will best serve all of us, but that slows them down. And the rollout for that was delayed. And then, they're dealing with transitions in leadership that you're all aware of. So I believe that's part of them. You're never going to hear me throw them under the bus because they couldn't have helped me, but it's on the opposite end of the spectrum. We submitted our requisitions for those 14 positions in August, and we have yet to see them posted. So they're challenges, but in the meantime, they've put out 15 fires for me around that. So there's, it's just a balance, and it underscores where we are. I know that Nancy Cross, the mayor, and other folks will support me if we have to wait too much longer to start advertising for those positions. But Sonia Gray probably doesn't even know where the bathroom is on her hallway. She's been here so new. So we just need to give her time to settle in and deal with all the other, there's health that are dealing with these things in every department, including streets, as you know. And so just giving them time to catch up with all of that. So it's rough, but we're in communications with them. Trust me, they get a weekly email from my person around where we are with these job posts. It's just they're dealing with a lot, I think.
Sure. That is really helpful context. And yeah, it's helpful for us to identify points of conflict, but then if there's nothing we can do about it, it's good to know also sort of in context what's going on. I don't know that I have any other questions at the moment. I just
And thanks to you, I did put the link for the impact report again. I'm sure you guys get like me, hundreds of emails a day. But like I said, there's page 3 is the workforce capacity, but really take a gander at the accomplishments of the staff. Like she said, they're incredible. And then I did put a contact list for you guys to easily pick for your newsletters or other groups for things that we have now. But to Alderman Gunther's point, I think we'll definitely build a dedicated one for behavioral health right at the beginning of the rollout, so that will start to make people invest. And then I'm happy to work with you guys around your thoughts around, either neighborhood meetings or a town hall, some in person, and that address folks that don't have transport, don't have internet, how do we get to them as well? Happy to work with you on the rollout at that time too.
Yeah, absolutely. Thinking ahead to the spring for some meetings. I know we've got some engaged neighborhoods that would love to hear from you. So we'll be in contact about that. If there's a specific point person we should be talking to and not filling up your inbox, please let us know.
No, come to my inbox. That's important.
Okay.
And again, I just don't want, you guys are the most respectful group of partners and leaders. Like nobody wants to bother me, but it can't get to the point where we're not getting anything done. So just email me and then I'll put you in contact. Scott Timms, who's the program lead, will be the person that ultimately sort of meets with you guys. But it's important for me to know what the initial asks are so that, I'm making sure that we're getting you guys what you need. So I appreciate the consideration, but yeah, send them to me and then you'll quickly be introduced to Scott and the team for what and specific people depending on what the ask is.
Yeah. Okay. Well, I guess just in conclusion, thank you. Thank you. Thank you. Thank you. You were incredible. You are moving mountains and we are so grateful. We're
Stop
so
embarrassing me. Let's move
nope,
on.
I'm doing it. You deserve it and I'm doing it. So thank you. Okay. I'm done.
Thank you.
Madam Chair.
Alderman Todd.
I don't have anything to, thank you for coming, Dr. Monty.
Thank you, Alderman Todd.
You're welcome.
Alderman Grass. Alderman from the 28th, are you still with us? Alderwoman Keys, do you have any questions?
No questions. But again, thank you, Dr. Monty. It's always a pleasure to be able to sit and listen to you tell us about what's going on. I appreciate it.
Thank you, Alderwoman Keys. You also have a very warm face. So when I'm nervous in presenting, my eyes go to you because you smile and you have inflection. So I just wanted to say thank you for that support.
Well, thanks again for spending some time with us. Keep us posted, especially the Health and Human Services Committee, on how we can support not just the Behavioral Health Bureau, but any of the work that you're trying to move forward. I realize what an uphill battle it is, and we're available to put some time and work in if we can have your back on anything. And
you always do. And Chairwoman Garcia is being very humble. We communicate a lot, as I do with a lot of others of you on the call, around, other critical issues that we probably don't have time to discuss on the scope of this. So that's helpful. And I would really welcome that. I actually just have a question for you all, because you don't always ask me to come. And so I want to be sure that I'm following up on things. So I did have a clear deliverable about rollout, implementation, and contact information. But is there any other, follow-up information? So you will get these slides. That will be one of the follow-up deliverables as well. You do have the impact report. Is there anything else that would be helpful for me to follow up with, or other questions I can answer either now or at a later juncture for folks on this call?
I can't think of anything, but anyone else, please feel free to jump in if there's anything you'd like to add to Dr. Mahdi's workload.
Yeah, Alderman Rice.
I'm so sorry to do. The one lingering question that I still have, as we are going into holidays and watching people around me tick up on those positive COVID cases again, what is the best way if we are at home testing, if we're not seeing a physician, that sort of thing, if we test positive and want to contribute that data to the city?
Such a good question.
How do we do
that?
I'll
get you guys that contact information. So our EPI team is collecting folks who volunteer antigen test data from home. And we do include that and explain to people how limited that data is in reporting, but it's still important for us to collect. So the county and the city does. I'll make sure I include that in my follow-up as well.
Okay, great. Thank you. That's the sort of one lingering piece on COVID that I had questions about. So,
And I just wanted to acknowledge, I did receive an email from you about a nuanced topic around what we should do around marijuana. I need to actually sit down and talk to you because that's a really complicated topic that requires us to be thoughtful about all the areas of nuance.
right.
So we'll follow up on that. And then many of you have reached out to support me and to push on the ongoing, probably my biggest crisis and consistent crisis is the issue around animal care and control. So I think there's opportunities for us to follow up on that. But because of the advocacy of many of you on this call, I was able to get additional funding that we will benefit from. But because of existing contracts and leases, I don't think we'll see that immediately, but those things are in the works. So also happy to provide a report on that at a later juncture. But I did want to acknowledge, because all of you have done a lot to support me and to hold me accountable, as you should, as is my job. So I'm happy to come back at a later juncture if that's helpful. But so yeah, contact information for behavioral health per Alderman Gunther, contact information around where you can report COVID tests. Anything else that folks would like from me?
Alderman from the 28th, I don't want to put you on the spot, but I just noticed you rejoined us. So if you have any questions about the Behavioral Health Bureau or anything else before we let Dr. Mahdi off the hook, please feel free to weigh in.
No, I was listening. It's very informative, so I appreciate it. And I think it's very necessary, with unfortunately our city just has a lot of trauma and the effects of that, affects us all. So I appreciate the work you're doing.
Thank you.
All right, Dr. Mahdi, we'll give you the rest of, well, I guess 11 minutes back.
It's a lot of time in my area. I can knock out a good, 5 to 7 emails in that time. So I appreciate all of you. Thank you so much for your work. Thank you so much for supporting me. You're all very humble, but many of you are supporting me in many avenues all the time. So I really appreciate that. And we'll talk soon.
Sounds good. All right. Does anybody on the committee have any announcements before we move forward? Please excuse Alderwoman Middlebrook and Alderwoman Green for necessary absence. And I will entertain a motion to adjourn.
So moved.
Second.
All in favor, signify.
Aye.
Aye.
Have a great rest of your afternoon, everyone. Thanks for your time today.
Thank you.
Bye.